And cholera is killing over 140,000 each year around the world from some 4.3 million cases. Health officials suggest that basic hygiene can prevent most of such deaths. But in the central region town of Moree, poor sanitation is killing many. In 2014 alone, over 134 people in the town contracted the disease, with some dying in the process. But as Felix Akoyam found out, many residents still do not care.
This is Moree, a large fishing community in the central region. The coastal town is famous for many things, including tourism. It is also the hometown of the second gentleman of the land, Pakwisia Mr. Arthur. But there's one thing residents here are not proud of: poor sanitation. This makes the area a cholera endemic one. And there are many victims here. People have had to bear the brunt of a public negligence. Many people have been killed by cholera in this town. I meet Ajua Kunua, who is in her 60s. Ajua lost her husband in the last cholera outbreak in this community. His death is still fresh on her mind.
My husband complained of stomach upset. His upset worsened, so we took him to the hospital. He died shortly after he was admitted.
Ajua is frail and jobless, making life unbearable for her and her grandchildren following the passing of her husband.
My husband was our breadwinner. Since he died, I have had no one to take care of me.
She lives just meters away from the seashore. And here, that means living close to filth and open defecation, the possible cause of her husband's death. In spite of this, health officials in this community say they are making strenuous efforts to deal with cholera.
In 2012, we had it, and we had it in 2014. That was the last year we have it. We had it 2014. We had 134 cases. We had one confirmed death and one suspected death. But all the rest, all the 132 were saved.
We still saw people defecating along the beach, garbage left along the beach. Would you say that the people are really listening to your campaign, and is it really working?
Some are listening. Some are listening. But some are also deaf to the campaign. Some are listening. So if they had not been listening, we would have had the problem coming since last year and this year. So we will say that, well, some are not listening, but some are listening.
Nonetheless, a lot of work, both psychological and physical, needs to be done to deal with this public health situation. Felix Akoyam, Moree, Joy News.
Well, we'll still keep our focus in health right after the break. We'll look at one other thing happening today. Lab scientists across the country in public hospitals have withdrawn their services. It's having a certain effect on healthcare delivery in the country. We'll bring you that update. Plus, my colleague Kwame Boateng has been busy in the United States. He's back with a lot of help for those living in very deplorable conditions in Ghana's prisons. We'll bring you details on that, plus more, here on the show. Stay with us.